everybody. Welcome to Safe Space Talk. So I'm Renee. I'm the inclusive midwife on IG.
And I'm Keisha. I'm the hood midwife on Instagram. And we have been doing our birth bundles, but now we're kind of getting back to doing a little bit more education. This time not on OB, but more on gynecological things. Today we're going to talk about contraception. But before we do that, we're going to have Renee light our ceremonial candle.
Our handy dandy. Please do it right for the camera. Candle. So this is for everybody that's just breathing, blinking, just trying to make it, going through everything that you're going through, trying to make big steps, make little steps, just make it through the day, all of those things.
Maintain.
Yes, maintain and grow. So I'm going to take this and bring it over here. There we go. Okay, so that's to let you know that we're thinking about you and we've always got you on our mind and you are on our hearts and we are lifting you up. So we're going to go right into it. We're going to try this. We've got our new mic, so we're trying to make sure that you guys can hear us
well. But
so if we look like we're projecting our boobs,
it's just
not
trying to get that energy out there.
It's the big boob energy and the microphone checkup. So it's Contraceptive Day.
Yes, contraception. One of the biggest reasons I get people to visit me. That's why I'm excited to do this. You would think that we've had contraception around for what 70 years now.
God, yeah,
70, and they've come a long way, but it's so limited.
Mm-hmm.
Like no birth control is without risks. No
Mm-hmm.
birth control is without drawbacks.
Yep.
And people are always amazed when I go through like all the contraceptives that are available to them, and they're like, "There's nothing else," and I'm like, "No,
this is the best of the
no, a vasectomy
yes,
is what we have." And I push those quite frequently as well.
And yeah, good luck with that because let me tell you what, the vasectomies are not. The males are not thrilled.
No, but
to go for that
they
vasectomy.
can be not thrilled for a while. It's fine.
It's like, good gracious,
Yeah.
like give us a break.
After we done did everything, carry the kids. Yeah.
I will say that my one pet peeve about contraceptives, kind of like what you were saying, is that for hetero genetic women, we can only get pregnant. We are most likely to get pregnant for a short period of time, for a short period each month, which is a short period of each year,
Mm-hmm.
which is a short amount of years in our lifespan. But yet I would say 95% of all contraception falls on us to carry it. But males can literally create children.
Yep.
Heterogenetic males can create children from birth till death. And they can put it in a jar and still create kids after death. Like Tupac could still be having kids out there right now. But it's still us that tends to have to do all of the contraceptives.
Yes.
And I'm like, no, you can get us pregnant anytime.
It's frustrating.
You should be doing most of the work. So I'm all for the vasectomy. So that's my
least
pet peeve for the day. So let's start with the lowest amount of effectiveness all the way to the highest amount, and we'll just kind of ping off of each other.
I want to say it's like 46 to 64 women out of 100 will get pregnant using these methods. So a good amount.
Yes,
like
50-50 chance.
Yeah,
but better than Vegas odds. So, I guess
it depends on what your goal is.
Yes, it depends on how desperate are you to not get pregnant. Yeah, because if it's not the worst thing that can happen for you in the world, then it's a very realistic option.
Yes. So the barrier or the family planning methods. Mm-hmm. So family planning method is one that I like. I used it for many years. And it's basically just having a cycle awareness. You can use it through apps, but obviously, like you saw in one of my last episode, the apps are not always foolproof. So learning your body during the different stages and the different parts of the cycle, and actually learning the menstrual cycle, which is the hardest, I think, for a lot of people to understand, like what happens when. So basically, with family planning, you have to know that the day one of your menstrual cycle, the first day you have your period, this is without any birth control. This is if you are just regular.
The biggest thing
you have to be regular.
To have a regular cycle. It can't be. Sometimes it's 20 days. Sometimes it's 29 days. You are not a candidate. Yes. Sorry, you just lost that option.
Yeah, you need to be very regular. You have to have cycles every month. And you have to have them, like you said, within a very regular time frame. So anywhere upwards of 25 days all the way under to like 31 days can still be regular. So that's the first thing. You can't be on any other kind of birth control because that's going to just throw your cycles off and create a man-made cycle. It's not really your own cycle. Then, so first day of your period is day 1 of your menstrual cycle. Day 14, so 14 days from the first day of your period, is the day that you should technically ovulate if you have a 28-day cycle. So halfway in between.
Yeah.
The days leading up to it, so 2 days prior, 2 days after that, are days that you can still either be ovulating or your egg can still be there to be fertilized. So those are the days that we want to make sure we're not having unprotected sex. So this is when you're using barrier method. You can use pull out during this time. Not sure how great that will work. So for some people it works. You can
it works if they do it.
Yeah, that is true.
You can't get caught up in the moment.
Yeah. So those are so you have about, maybe I would say, and even to be, if you really want to be safe, give it a week. So a buffer. So if you ovulate on a Wednesday, Sunday to Saturday, you're using that, and that's your time that that you are most likely to get pregnant, and you need to be careful. After this, your body has figured out, after that time period passes, your body has figured out you are not pregnant, you have not been fertilized, and then it starts the whole prep to take down your uterine lining again, which then will result in a period. So that is the family planning method in a nutshell. You do have the ones where they're more in depth, where you're taking your basal body temperature, because there's changes in your body temperature when you wake up in the morning, different parts of your cycle. You start to learn your mucus. Your cervical mucus is a lot more like, they call it egg whitey, I guess, during when you're Spinnbarkeit. That's a German word. Yeah. So the amount of elasticity it has and the stretch it has and the ease that semen can pass through it versus other times when it's thicker, does not allow semen to pass through. So these are things you need to start learning and noticing about your body. And then obviously you will start to learn what it feels like to ovulate. Some women might not feel it, but like I've said before, I can feel what side I'm ovulating from. It feels like a very dull pressure that comes from the side, from the inside. It kind of almost feels like if someone like blew up your kidney, just like on the inside of
and
you.
it's like, for me, it was always like right here. Like,
And it lasts
and it's almost like you want to push against it.
And it lasts for maybe a few hours or so, and then it kind of passes. So those are all signs that you've ovulated and that you should not be having unprotected sex if you do not want to have a child. So that's, in a nutshell, family planning.
Yes. Okay. And then the next one that's also in the same range of efficacy is spermicide. So that would be literally a gel consistency. I don't know. A gel, just gel consistency spermicide. You place it inside of the vaginal area. You literally squirt it in there. You can put it on they usually either give you applicator or they'll give you like a cervical cap. And
I've even seen spermicide strips at the store.
Well,
that you put the strip in the vagina.
I feel like that.
It's like a film almost. I think that
I was about to say, if it's a string, I'm not feeling it. But okay, I can take that for $1. I'll take that. But it's supposed to change the pH to where it is not a happy place for the sperm to actually grow and be able to do their thing. It's kind of like if you can imagine an army and you're behind a wall.
Think of a pesticide.
And they're like, some of them are still going to make it. Like some are still going to be,
but way less, and hopefully not enough
to get to the egg and breach that fence. So that's the spermicide. The next one that goes a little higher. So now, if I'm not mistaken, this is like 60 to 80% effective. If I'm not, we're looking into barrier methods. So, and I want to say this because condoms get a bad rap. Condoms get the worst rap. It's worse than PIT in labor and delivery. Condoms work. Y'all, please stop. It works. They are effective.
And they protect against STIs.
And they're the only ones that protect against STI. So if your goal is to just not get pregnant, then contraception is for you. If your goal is, oh, I don't want to get pregnant and I don't want to catch herpes, or I don't want to catch this or that, then you want to add a barrier method in. So for males, it would be for to apply to the penis, we would have the male condom. Then we have one that is a female condom. It looks different. It actually goes into the vagina, and it actually has like the ring for the male condom, but it's on the outside, and it actually goes around you like this. So your vagina is actually encapsulated completely by this film. So the good thing about it is that if you have oral exchange of sexual encounters, then that decreases the chances of the male contracting topical STIs from just doing that, if that makes sense. And then,
or even I would say probably decreases the chance of getting even like gonorrhea and chlamydia, because if you're like burying some of the vaginal secretions, then
it's not getting there.
Mm-hmm.
Exactly. So that's one good thing about it. Now that's the female, we went to the male. You cannot have the male and female condom used at the same time. There's one thing. So you both can be giving it a good college try, but only one of you can wear the barrier method. So it can't be both of you wearing it at the same time. And then there is withdrawal, just like she said. So everybody that's watching this, if your kids are in the room, obviously this is not the episode. So whenever the end goal is obviously orgasm. So women, sometimes we get it and sometimes we don't, but more often than not, the males will have ejaculant come out. That's when you want to retreat, which means pull the penis out completely of the vagina, not all just the tip. And you put the ejaculant onto any other surface aside from inside of the vagina.
Literally
any other surface. I don't care.
Be easier.
Could not be easier. What's that little Danny DeVito meme? So anyways, I was just blasting. I just started blasting.
So do not shoot the club up. Shoot outside the club up.
Exactly. Shoot on the outside. So that's the withdrawal. And then we have our sponge, which is exactly what it sounds like, y'all. I just can't make this up.
And you lube it up with spermicide, right?
With the spermicide, and you place it all the way in the back of your vagina where your cervix is, but basically as far back as you can possibly get. And your practitioner will help you learn how to fit like diaphragms, cervical caps, sponges, things like that. And it creates that barrier to where it's blocking the cervix so that the sperm is not going in there and getting a chance to get onto the highway and make babies. So that's our 60 to 80%. Remember, the male and the female condoms are the ones that protect against STIs. Those are the ones that protect against STIs. As a matter of fact, spermicides and diaphragms can increase the chances of you catching an STI because of the microabrasions that they cause to the cervix. Because you have to remember, this is a spermicide, so it's strong enough to kill microscopic things, which are cells on your cervix as well. So now we're going to jump up to more effective.
Yes.
When with perfect use, I want to say it's 85 to 95. I feel like it's the number I remember, 85 to 95, because it was like a grade that you would want to get.
Perfect use is the optimal
perfect use.
Word, though, because no one that I know uses birth control perfectly. If they have to administer it to themselves daily, weekly, whatever, there's always going to be some.
I can't tell you how many family members have asked me before, do you have any extra birth control pills? First off, you shouldn't. And no. This is not I have a couple of
Advil.
them. Exactly. I've got a couple of them and my boyfriend's going to be in town, so I'm just going to take these.
No.
As a matter of fact, you're probably going to get pregnant with multiples. Yeah. It's actually shown that if you do that improperly, you're more likely to have multiples whenever you
because your eggs are just
anyways, I was just blasting. That's gonna be your thing. So I was just blasting.
Ovulation
overload.
Theme. Okay. So this is with perfect use. So we have Depo-Provera. This one is notorious. Everybody says, I gained 60 pounds on Depo.
Tell them.
And then whenever I stopped, I dropped all of it right away. Which I have seen happen, but more than likely it's just aging. As women age, we tend to gain weight. As people age, we tend to gain weight. You're less active. Even if you are more active, sometimes you still tend to gain weight because your metabolism just slows down with age, especially after like 30. So Depo-Provera is a progesterone-based shot. You get it in your arm, but however, it's IM, intramuscular, and you get it once every 13 weeks. So for like at my clinic, we prescribe it, they go to the pharmacy, they go get it, and then they come back to the clinic and we give it to them. So then you get your little schedule card of when you should be coming back to get it. And this is something that like you need to kind of be staying on. Like you can probably have a grace period about a week or so, but I wouldn't be pushing progesterone to the limits like that of I'll get it here, or maybe push it to 6 months, or whatever. Just stay on your schedule. Yeah, that's perfect use right there.
That is perfect use. And to piggyback off of that, what she said with the weight gain, I remember this for some reason. It is responsible. It can be held responsible for 4 to 6% of your body weight gain. So let's say you're 200 pounds. 10% of that would be 20 pounds, right? So you figure less than half of that is 10 pounds. We can gift you the first 10 pounds,
Mm-hmm.
could be from Depot.
Yeah.
Everything after that is the fork. I'm sorry. I hate to take that from you, and there's going to be so many. There's a ping, ping, ping. No, it made me. No, and it's not 10 pounds each shot. so, so I promise you that that's the God's honest truth. So, if with good diet, it will work. So, I don't want people to feel like a really good viable option is not an option because they're going to gain 30, 80 pounds, like family members said that they did.
It works. So progesterone, I want to just like put this out there because this is going to be mostly true for the rest of the progesterone based ones. So progesterone is used in contraception a lot. It primarily works by thinning your uterine lining, so there's no embryo can implant, no baby can implant into, and then thickening your cervical mucus, like we said before, like it has to be a thin cervical mucus that semen can get through. It thickens your cervical mucus that semen cannot get through it. So sometimes it will stop you from ovulating, yes. I see a lot of people say, "Oh, get progesterone based and it'll stop you from ovulating." Sometimes it will, sometimes it won't. So, it is not inherently that it's not its mechanism of action primarily.
Yes, exactly.
It can, it definitely can, but that is not it's the primary one. Usually, estrogen based ones are going to be more stopping ovulation. That's their method. Yeah. So moving on to the mini pill. The mini pill is not the pill that you're normally thinking about when you're thinking about the pill,
birth control,
because that has estrogen and progesterone in it. The mini pill has only progesterone in it, similar to the Depot. So similar to the Depot, you're not going to always know what your bleeding patterns are. You might be one of those people who doesn't bleed at all anymore. You might spot all the time, or you might just spot here and there. It's kind of up in the air. Adding on to that is a lot of times the people who are put on the mini pill are right after having a baby.
Yes.
So you're already not going to know what your cycle is like based off of that. And if you're and if you're still breastfeeding, that's going to throw your cycle off or not make you have one for however long. So the mini pill is the benefit of that is for women who are over 35 who are smokers, who cannot have estrogen.
Women who have migraines.
Women who have any kind of cardiovascular issues that we're not trying to trigger. And mostly the biggest people that I prescribe it for is moms right after having their baby because they have a higher chance of getting a blood clot. So we don't want to induce those with the estrogen that we were giving them. So we give them the mini pill. And we also don't want to tank their milk supply.
And I also just had a flight of idea. Me kicking in. It's migraines with aura. Am I thinking about that correct? If I'm not mistaken, it's not just migraines because so many people are diagnosed with migraines.
Okay.
But it's the migraines that actually have aura. That are you're a higher risk, if that makes sense. So I think everyone thinks a migraine is just a bad headache, and that's not the case. The mechanism of action as to why you're having pain with a migraine is different than the pain that you're having with a headache. You'd have to have a neurologist explain it. We could do a whole show on that. Maybe that'll be something we do. But it's a different rationale as to why your head is actually hurting you. So anyways, if you have that, you have aura, it's like not a sense of doom, but you feel like you're looking in a fishbowl.
Yes.
Things go mute.
It's like a bubble effect.
You have to like Google migraines with aura, and they are at the highest risk. And then I think if you have migraines that are cyclic as well, they say the same thing.
Yeah, because usually the cyclic nature is just kind of on the woman's cycle anyway. So us doing a fake cycle by hormones is kind of going to reproduce that.
Yeah.
And then we have the patch, the ring, and the
and the that diaphragm. I still can't believe that's not gonna. So anyway, so now we're gonna do the combined hormonal. So what Keisha was talking about was the progesterone. So the progesterone, I want you to think P for protection. We're protecting people against cardiovascular, all of those things. So the estrogen, we're going to think like healthy is HE. So if you're healthy, you can get estrogen. So basically, these are going to be for you people that are not smokers. They are not recently given birth or anything like that. But they can come in a patch. So the patch goes anywhere on your skin. It can go here, I think the stomach, the buttocks. I don't think they do the thigh anymore, if I'm not mistaken.
I think that's probably too much with your
pants. So I think it's the buttocks, the stomach, and the thigh. I mean the arm. Either way, you can put it on your skin as long as it stays on. Each of these methods are 3 weeks on, 1 week off. That's when you have your man-made cycle, or your withdrawal bleed, your breakthrough bleed. and then you start back again. So let's say your end goal is to not have a cycle. It would be for your provider to write, skip the placebo week.
Or write continuously.
Yeah. And just keep moving, because you'll, like we said before, your insurance would run out. So you have the patch. That's going to be estrogen and progesterone. That's going to work by...
Oh, and I did want to add one thing, because when I tell people that, their first question to me is always, am I going to get fat, or is it healthy to not have a period? And yes,
it is.
You're not going to get fat.
You're not going to get fat.
But yes, it is healthy to not have a period. It actually is healthier than having several periods. Because it's protected, right? It decreases your chances of ovarian cancer
later on.
So I think that's pretty cool. So the people who've had a million babies who've skipped those periods have a lower risk.
Exactly.
I know, I'm in there.
And that's why, so I always wondered how breastfeeding was supposed to be helpful in decreasing your risk of cancer. But if you think about it, if you breastfeed for 2 years and you don't have a cycle, here you go. It's protecting you from having the cycles. That lactation amenorrhea is what it's called. But anyways, yeah. See, y'all can tell we love this. This is our powerhouse. But yes, just like she said, so it is healthy to not have a period, so you can do the placebo week. But the estrogen and the progesterone work very well together. So, for instance, let's say you have like PMDD. If you have a lot of cyclic disorders, or you find that you're very moody, progesterone is usually what you're lacking, but estrogen is like the best friend to it. So they work really well together, and they pair well together. I don't know how else to describe it without getting so... Yeah, it's like to not take it down to that microscopic level to where it's going to be way too much. It's basically just imagine two friends, like peanut butter and jelly is better on a sandwich than one by itself. So basically they are going to be in each of these. So the patch, the ring is not for people who are afraid to put their fingers in their own vagina. You have to place that up into the vagina. It will land where it's supposed to by default. Just place it as far back as you can, and it works no matter what. And then it's the patch, the pill, and the ring are all combined hormonal. So all of them do the same. They all will regulate your period. You are less likely to have breakthrough bleeding if you choose the estrogen pills or the estrogen combined one rather than just progesterone, because estrogen has more control over your period than the progesterone does.
That uterine lining nicely.
Yeah.
Keeps it nice and stable, and then the progesterone is what's gonna...
because the progesterone is supposed to make things quiet, like quiescence, whatever that word is.
But it thins your lining out.
But it thins it out, and the estrogen is what fluffs it. So, like, basically what you have is it's the estrogen, if you can imagine, it's like putting a comforter on a bed. So every month you put like another comforter on your bed, then another comforter on your bed. Eventually it's going to be a point where your bed is like, listen, boo, this is not the Princess and the Pea. Yeah, exactly. Like, some of this lining is coming off. So eventually have some type of breakthrough bleeding just because your uterus is like, look, honey,
it's like a forest that's too overgrown and it has to come down. And then the opposite, the flip side of that, the why you have so much bleeding with progesterone is like, I always say it's like a lawnmower. It trims the lawn. And if you have only progesterone based, it's just trimming the lawn and trimming the lawn and trimming the lawn. And then sometimes it gets a little crazy and trims too much. And then you're bleeding and spotting. And that's what you're seeing on the outside. The physical side of the lawn trimming is coming out.
And then then you get the 1/3 of people who they don't have another drop. Like they don't have another drop.
It got trimmed and their lawnmowers got put in the shed for the rest of the time. They're like, we did our job.
Lucky duck, you are wonderful. But yes, so those three. So people would say at this point, like, well, if the progesterone is by itself, why would I even bother to add estrogen if it sounds only for healthy people and riskier? Because of the fact that it controls the withdrawal bleeding more.
And it stops you from ovulating.
Yeah, it stops the ovulation, period. So you don't even have to worry about that. So for people who, how do I word it? There are people who want birth control to cease ovulation even occurring so that they're not terminating anything that could have been. Does that make sense? Yeah. I can't remember what it's called.
They don't want anything that's been fertilized
to fail. So if fertilization occurs, they want it to stay. They want everything to stay intact. So for those who don't even want that to occur, that's where the estrogen comes in, because it just keeps your body makes your body continue to look for pregnancy.
PCOS, who you don't want having all those cysts,
developing.
Yeah, you kind of stop the ovulation from starting
occurring.
to happen.
They still develop all those follicles though, because it's still building up those follicles.
Not
but
as
at least
bad.
they don't.
Yeah, usually they're not as bad from what
they love it though.
In my practice. Usually, I feel like that controls PCOS, the cyst portion of it, better than the progesterone only base. Progesterone only base controls their bleeding a lot better. But
that's why I feel like it works better for people with PCOS.
What, progesterone base?
No, both of them.
Oh yeah.
Because it's like you have to have one attacking this angle and the other attacking the other angle, because it's so multifaceted.
Yeah.
That's why I feel like progesterone only is not going to fix.
And that's what everybody gives them. I'm always trying to control my face. Yeah, whatever they tell me, they're like, well, they tell me I have PCOS, so they're gonna give me this, and I'm like, I mean, if it works, great, because it could stop your ovulation. It could do the thing.
It could write differently. Yeah. How about that? We would write differently. Yeah. I want to attack it from both fronts. Like, I don't want to just symptom manage. I want to attack both sides of it. But so it'll stop the ovulation.
It's good for the people who aren't candidates. So, I guess everything has.
Place. Yeah. Well, that's true, because if you're PCOS with a smoker and the smoker, like, that's kind of gone. And it could be that too, because I feel like a lot of people with PCOS have migraines.
Yeah.
Have you ever noticed that? Like, I feel like they're almost like gonorrhea and chlamydia. Like, they come in, they come together. I don't know what it is, y'all. I'm telling you, gonorrhea and chlamydia, like, they ride buddies. Together. They're buddies. Like, usually if you have one, you have the other. Anyway, technically, it's as effective as the progesterone only, but it gives you the slightest, and I mean, of a mustard seed, the slightest bit more. Okay, you may have slipped up today and forgot your pill, but you're gonna be all right. Yeah. Whereas the progesterone's like, honey, after 24 hours, you were on your own, honey. You should have took that pill on time. So that's those. So the patch, the ring, the pills, all of those are the same. And like I said, if you wanted to skip the periods, that's where you can get your practitioner to write differently. Now, believe it or not, in the same level of protection is the diaphragm, which we have to have that fitted. I know, fix her face. Tell her, everybody, fix her face. You put your diaphragm in prior to expecting sex. So it does kind of take away the spontaneity, I guess.
Because you can't have it in there for hours on end prior to. Yeah. Because you have to put
spermicide around it. And so you can use it without the spermicide and have it in, I want to say 6. For some reason, the number 6 is in my mind. You can have it in 6 hours before and up to 6 hours after.
I think you have to keep it in for a certain
amount of hours. Yeah. I think it's a minimum of 2, but I feel like up to 6 or something like that. And then, of course, then some people are like, ew, now I got to go up there after all of that's been in there and take it out. Yeah, honey. I mean, it's got to, what goes up must come down.
So if that's not for you, then that's not for you.
Yeah, if that's not for you and you don't want to go rummaging up there with everything that's up there, then this would not be for you. However, it is in that same category of efficacy, believe it or not. So if you do it 100% correct, then you are covered. So the next step, the layer that is the most effective, like we promise you is the most effective. Yes. Like these are, I would be desperately depressed if I got pregnant at this time. This is for you. So we have the implant, the IUD, and then sterilization.
So the implant is now called Nexplanon. There's been very many versions of this. It was Norplant for a while. I had it when it was Implanon. I still have my little scar right here. You see all those?
Mine is right there.
All those commercials of the girls, flexing.
I have no muscles, but mine is still there.
And they've changed the location. So it used to actually be on the side. Now it's more towards the back of your arm because people were getting them, quote unquote, lost. They weren't really lost, but they were burying and moving from where they were. And I've had that a couple times too, where they were placed and definitely nowhere near the scar.
Oh yeah, my doc was digging to get it back out. I was like,
scar tissue and everything can encapsulate it. However, like Renee said, top efficacy, you can't mess it up. What can you do to mess it up? Nothing. Do you put it in? You come to us, we numb your arm. We place it in. It's less than 30 seconds. It's basically like a big needle. I kind of took up into your skin. And
she said big needle, but don't go by the big needle because remember we numb you
it
up
for sure.
First
we numb it.
With
most
the tiny
people
needle.
Say that's it, or like,
have
you done it yet? Yeah. And you're like, yeah, it's done.
Have you done it yet?
And then I put a pressure dressing on for about 24 hours. Tell them don't lift anything super heavy for that 24 hours, and then after that, take it off, and the skin has already kind of come over it. Then after 3 years, you come in, we numb you again, we pull it out. You can get it replaced same day, pull one out, put the new one right back in. Yep. The thing with this is, remember, it's progesterone only. So everything that I said about progesterone before still applies to this.
So the rule of the thirds: 1/3, no bleeding at all. Second third, who knows, scant, moderate, and then the other third,
all the time.
It's just consistent. It may not be heavy, but consistent.
Mm-hmm. So there's no estrogen, so it can be used in smokers. And people will have who've just had babies. Now, side effects, the most common side effects are mood swings. So if you have emotional issues or mental health issues and they are not the best at the moment, just be aware that this could make them worse.
Which is weird because progesterone usually makes the mentality much better. Because for PMDD, that's what they give. Yeah. It's a high progesterone pill.
Yeah. But it's not spiridone.
Oh, yeah, that's true. The okay.
And then you have the IUDs that are lovenorestrol. I can't even say it. It's progesterone. It's a type of progesterone. You have those in the IUDs, and they are placed in the office. Now, IUD placement by no means is comfortable. Most women, if they were to come back, say it's uncomfortable. Mm-hmm. I'm sorry. And you can ask for pain management ahead of time, but like numbing the cervix and stuff is usually not going to be effective because the pain a lot of time could be from the cervix, referred pain. Yeah. But it's more from me actually inserting something in your uterus, responding and cramping down and kind of like, having that response to me trying to insert something in your uterus. So I could usually say take 800 of motion prior to. If you know that your period is going to be coming, that's the perfect time to get it placed because your cervix is a little bit more open and easier for me to guide that thing in.
Or if you're ovulating, which is not the time, but.
And then sometimes I also will prescribe what's called Cytotec to open up the cervix. If we've we've tried it before and it wasn't successful, to aid our chances of success the second time. First time I'm going to give you Cytotec, and then I'm going to have you go to a different provider because honestly, this is just something I do. If I feel like if I had bad luck and I just wasn't getting it, I'm not going to waste your time twice. Mm-hmm. I'm not going to waste a device. We already sometimes open that first device. And now we have to wait another week so I'm not going to do that twice to you. So let someone else have a try. Or if I think it's a very difficult placement, I will have them go to an MD under ultrasound guidance to have it placed.
Yeah. That's a good idea.
These last for quite some time. So 5 years is what was kind of the running average between most of them, and lately the FDA has changed that.
Yes.
So now if you're getting it depends on what reason you're getting it for. Yeah. So if you're getting it to control heavy bleeding,
dysfunctional uterine bleeding.
Yeah, they want to still keep you between 5 to 7 years. I want to say 8 for the birth control and 7 for the bleeding because you need more progesterone to quiet the
bleeding than you do for the birth control.
Yes. Once you have those in for a while, it pretty much goes into your uterus. The biggest issues I see with these are they are not placed correctly or they have shifted. So they need to be sitting at the top of your uterus, and when they come down into your cervix, they can cause cervicitis, which is like going to end up with a lot of discharge. Sometimes like irritation along your cervix. Sometimes your partner says they can feel it. And it's just uncomfortable for the wearer in general and not as effective because it's not in that top of the funness. Now, because it has progesterone, it probably still will be pretty effective because it's putting that progesterone out into the uterus and like thinning the lining. So still, if it is displaced but not bothersome to you, it's fine to leave it in. So it prevents pregnancy for up to 8 years for Mirena, and it for up to 5 years for heavy bleeding. Okay. So you need more progesterone for your heavy bleeding than you do to prevent pregnancy.
And
then you have your copper.
And then we've got the copper IUD. So the copper IUD is very same. It's like a T-shaped. We place it in very, very similar. The only difference is that the copper in itself is a spermicide. So it changes the pH, so the sperm has a harder time doing what it needs to do. And it's also the blocking. So it's just the fact that you have something in your uterus that takes away that opportunity for something to implant. So it's more of a raw traditional reason as to why it's working. The old-fashioned spermicide plus the fact that your body is trying to get rid of it. So it's more so focusing on expelling things than it is of retaining anything. So that does kind of make the periods a little bit, I don't want to scare people from getting it because the way that it's described is it may make your period slightly heavier with slight increase in cramping. But imagine where you already are plus 10%. Like it doesn't take you from a 4 out of 10 with your cramping to an 8 out of 10 with your cramping. Like it would be a 4 out of 10 to a 5 or a 6 out of 10 with your cramping and with your bleeding. So it's because it's actively doing what it's supposed to be doing. Contrary to popular belief, this is something that, believe it or not, I've actually experienced and had to really go to bat. You can get this if you've never had a baby before.
Oh, yes.
Like that is, like there are so many practitioners out there and providers that are telling women if you've never had a baby.
It may be difficult to place.
Yeah.
It may
but
be
they're
more
like,
difficult to place, but you can do it.
And you absolutely can.
And
it's non-hormonal. So for those who really don't want to have the hormones, they want it to be more of a naturalistic thing going on, but have that assurance that you can use it right away.
They do have the hormonal Kyleena, which is slightly smaller, but that's their whole slogan, is that they're smaller than the Mirena, but they're so much, like, if you look at them, it wouldn't be, to me,
I feel like if I could have got the Kyleena in, I could have got the Mirena in. I mean, because I don't think the T is what's like drawing the line there. I feel like because it all goes in like this, and then it goes boing, yoing, yoing, yoing.
Right, yeah.
So I don't think the boing, yoing, yoing is where we're really, but nonetheless, I mean, I would market it that way too, sure. Because money. Yeah. But the good thing about the copper IUD, so it is, let's say, knock on wood, that we have an instance where we've had unprotected sex and we are afraid of getting pregnant. It is the number one, the top, the best emergency contraceptive that there is. And most doctors' offices have at least one just in their stock, like of things that they have. So if you're a victim of sexual assault and you really want to make sure that you do not get pregnant or anything, it's actually used as emergency contraception. So as soon as you can, you go right into the doctor's office. And I know it's a window. I want to say it's 2 days or something like that. But literally they can put that in there and it's immediate protection. Like you're protected once you walk out of the doctor's office. It's done. It's more naturalistic, more holistic. And the fact is that you're not getting that hormonal bypass back and forth. So then we go from the copper, which is good for 10 years. So literally per decade, like, when the digit turns from 2023 to 2033 is when I've got to go back. So the male sterilization, those that have a vas deferens, basically, if you have a penis, they go in, they take, it's basically a tubal, but for a male. Mm-hmm. They just go in, they clip one in the tube, and they clip the other in the tube. That way that they're not shooting anything. So you'll still have ejaculate. There just will not be semen inside of the ejaculate. So everything works exactly the same. Nothing changes. It's all the same.
You're still a man. It was you still on have your Wednesday. Balls.
My God.
Your voice won't turn to this.
Exactly.
You won't
Peter
be like
Brady
Maxwell all of a sudden.
Exactly. In touch with your woman's side. Estrogen is not going to populate into your bloodstream out of nowhere.
Out of nowhere.
You will be fine. It's going to be you last Wednesday, no different, except when you ejaculate, there will be no semen inside of it, and therefore you cannot cause anyone to get pregnant.
Sounds like a deal to me.
It sounds like a deal to me, and as simple as a doctor's office. Like,
you go in and you walk out. It's a very quick procedure, 15 minutes, 30 minutes tops.
And unlike us that have uteri and we just have to go and kind of shuffle into the doctor's office and pray this IUD goes well, they'll give you something to numb you down.
Oh, no, they'll put you to sleep. They put Pierre to sleep.
No, they put Larry to sleep too.
What?
They said it was because of his biology. I've been looking at that thing for years, and biologically I can assure you everything is intact and look like everybody else. I want to know what you saw from the naked eye that I hadn't seen in all these years. Like, it looks the same to me. Looks like the last one. Whole same spot. Like, I can't figure it out. But they put my whole husband to sleep for this. Meanwhile, back at the ranch, I'm outside somewhere probably squatting during contractions.
Yeah, right.
Yes. Like,
And get an ice pack.
And get an ice pack and a Motrin.
Walk
like,
it off.
after you done had a C-section.
And a pitcher of water.
And we had to take your dang uterus out and everything. Like, here's some Tylenol and Motrin. But meanwhile, my husband got put all the way to sleep for his damn vasectomy. Like, I can't make this up. But I figured he was more of I thought he was more of the exception than the rule. No, but it sounds like they're doing it for other people too. Anyway, so if something's wrong with your anatomy, you can get put to sleep just for your little 5-minute procedure. Your little 5-minute procedure. I'm like, what a waste of a perfectly good OR.
I think that's what they do.
Everybody opens and counts and all that. You got a whole CST in there to be able to charge. Mm-hmm. Yeah, because I'm still trying to say, what did you see in there that I couldn't see? Anyways, and then for the sterilization for people that have a uterus, they basically, I feel like I ought to just lift my shirt and be like, here's what they do. But essentially they go in, we tie your tubes. So if you can imagine, there's the uterus and then it looks like a T because you have your ovaries and your tubes. We can take the tubes completely out. So literally take the tube off of this side and the tube off of that side. So your ovary is just floating here. Your ovary is just floating here. And then you still have the uterus. If we take the tubes out, it decreases your chances of cancer later on. And if they just tie them like they did back in the day, like they used to say, burn mine, honey, they were burning everybody's. That's how they tie them. Like everybody's like, just burn them things down. I'm like, yeah, they burned them all. But they will tie it and literally like take a little thingy and burn each end of it. It is not 100%, but it is 99.97%. I feel like, if I'm not mistaken, because the Implanon is 99.99. So it's microscopic, the differences we're talking about here. But yes, so it's very, very effective. Can things happen and they, open back up? Absolutely. So hence why removing the tube is like 99.99% effective.
But then you cannot don't go into this thinking that you're going to get it reversed.
If you have the tubes removed. Now, if you have them just tied, there is the chance you can get reversal, just like it is for the vasectomy.
But you don't want to go into it thinking that.
Yeah, because this is your permanent, I never want to get pregnant again. This is not the unless
I meet the man of my dreams.
My dreams. This is the grimmest picture, but this is something happened and all of your family is gone.
In a plane crash.
I still do not want to have more kids. That's when you're at this point. This is not but if that were to happen, I would want to have another baby. Well, then plan on a surrogate. This is, you can't depend on it to be functional for that reversal. You're going to have 10,000. This will be that ping, ping. 9,500 people are going to give you their success story, because I know people that have had theirs reversed and got pregnant within that month. Yeah, everyone's going to have that success story in there. Tubes out is more effective against cancer, and that's pretty much all of them, though.
Yeah, there's a few small other ones that I've run into, but those are pretty much the gamut. So thanks for tuning in to Safe Space Talk, and we will see you next week. Bye. And
That's right.
God damn it!
I'm sorry. It's me. Let me shut up. Let me sip on my red Solo cup like we had a party.
What's in your cup? Don't worry about what's in my cup.
Don't worry about what's in my cup.